Hello there. Welcome to another edition of Health Matters, a presentation by the Ministry of Health. My name is Nazim Hussein. In our program today, we'll be talking about cancer that we sometimes don't normally like to talk about, and that's prostate cancer. I've got with me Dr. Rajendra Sukraj. He's a urologist attached to the Georgetown Public Hospital Corporation here in Georgetown. Doctor, welcome to our program.
Thank you, Nazim.
Great.
Thank you for having me.
Right. So tell us, first of all, for our audience out there who might not know, we've always heard the words doctors supposed to be doctors. A doctor supposed to know everything. But then we have specialized doctors, urologists. Who is a urologist?
Right. So a urologist is a surgeon who specializes in dealing with matters of the urinary system, meaning the bladder, prostate, kidneys, as well as the male reproductive organs. So those are the things. We do surgery, but we specialize in those particular areas.
Right. And in this case, we're talking about prostate cancer. But cancer on the whole has been a buzz recently, not only in Guyana, but around the world. And so much so, we have a lot of advocacy campaign as it relates to breast cancer and other forms of cancer. But sometimes there is, no one wants to talk about prostate cancer, and there's less chat about prostate cancer. Again, for those who might not know, especially the younger folks who are watching, prostate cancer, tell us a bit about that.
Right. So prostate cancer, as you rightly said, has not been getting the kind of attention that it needs. All right. It is the most common cancer in men. Right. It is the most common cause of cancer-related death in men, particularly in the Caribbean. And indeed, it has not been drawing the kind of attention that the other cancers have. And that is why we're doing these programs. That is why the Ministry of Health, through its Men's Health Unit, has been advocating, and they're increasing advocacy for this particular type of cancer. Now, if we were to back up just a little bit to talk about what is the prostate gland, because that's where the cancer originates. The prostate gland is a part of the male reproductive system. It sits just under the bladder. And so in fact, without a normally functioning prostate gland, a man will actually not be able to father a child naturally. But because of its location, the urinary tract from the bladder to the outside, where the urine has to come out from the bladder, passes straight through the middle of the prostate. And it's deep within the pelvis, so it does pose a few challenges. Right? So there are two general conditions, or two common conditions, which we see affecting the prostate gland. The first one is an enlarged prostate, which a lot of men are familiar with some of those symptoms, where it starts to squeeze on that urinary channel and give you symptoms. You're having to go to pass urine often, and it's not coming out with a kind of force that you're accustomed to. And then on the outside of that same gland, you can develop cancer as well. Cancer is when cells in that particular organ start to grow out of control, right? And eventually, once they take over, then they start to spread to different parts of the body.
Right. So not every frequent urination would, raise a red flag for you having prostate cancer. Who would be most at risk? We know it's men, but in terms of, you spoke about the Caribbean, who would be most at risk, and what age and so forth?
Right. So the risk factors, the persons who are most likely to develop prostate cancer were older men, right? The peak incidence is about 67 years. So as you get up in age, right? But we've started seeing cancers even in the 40s, in some instances, prostate cancer. Men of African ancestry, right? They're at higher risk. It doesn't mean other ethnicities are exempt by any means. It simply means that men of African ancestry have some of the highest risks that we see. Right? Family history. So if you have a father, brother, uncle who's had prostate cancer, your risk of developing prostate cancer increases, right? Significantly. And then there's some lifestyle changes which can increase your risk, including smoking and obesity. Okay? So those are some of the main risk factors. One of the problems, and in fact the main problem that we have with prostate cancer, is that those symptoms which we generally relate to the prostate don't actually occur in prostate cancer until it's very late. In the early stage of prostate cancer, at the stage where we can actually cure the disease, prostate cancer has no symptom, because where the prostate is and urine tract goes through the middle of the prostate, the cancers generally occur just around the periphery and the outside of the prostate. So they don't actually affect the flow of urine in the early stages, right? And when it gets advanced, when it starts to invade the rest of the prostate or it starts to spread to other body parts, including your spine, that is when you start getting problems passing urine. When you start passing blood in the urine, you get back pain. You end up, in some cases, patients are paralyzed because it involves the spinal cord and you're paralyzed from the waist down. Those are signs of advanced cancer. Those are symptoms of advanced cancer, right? But in the early stages, prostate cancer actually has no symptom. And that, that is what poses the biggest challenge in detecting these cancers in the early stage.
Right, we're talking to Dr. Sukraj from the Georgetown Public Hospital about prostate cancer. We'll take a break. When we come back, we'll have more for you on Health Matters. Don't go away. Did you know that 1 in 8 men will receive a prostate cancer diagnosis in their lifetime? While not always life-threatening, early detection is essential to treat prostate cancer successfully. You must visit a doctor to determine if you have prostate cancer, as it does not show symptoms in its early stages. Age, family history, and ethnicity can increase your risk of developing this type of cancer. Late-stage prostate cancer can cause difficulty urinating, weakened urine stream, blood in urine or semen, bone discomfort, weight loss, and erectile dysfunction. Talk to your doctor at the nearest health center to learn more about this disease and your risk factors. They can assess and suggest further screening if needed. Remember, early detection can make all the difference. Don't let this disease catch you off guard. Take control of your health today. A message from the Ministry of Health.
It's easy to forget about your mental health. So taking a break and prioritizing your mental well-being is crucial. When you're feeling stressed, anxious, or overwhelmed, yes, take a break or participate in an activity that will calm your mind or release some tension. Meditate, eat right, sleep in, exercise, or do something you enjoy with friends and family. Be bold and talk to someone you trust. With the proper support, you don't have to go through this alone. These activities significantly benefit your mental health and overall well-being and can reduce or prevent stress. Remember, you must prioritize your health and well-being. Caring for our minds is just as important as care for our bodies. Take that break, walk outside, breathe some fresh air, and come back feeling stronger or more refreshed. A message from the Ministry of Health.
Thanks for being with us on Health Matters. As I said, we've got Dr. Rajendra Sukraj. He's a urologist attached to the Georgetown Public Hospital. You mentioned age. People in their 40s and in the later stage are likely to, be infected by prostate cancer. And you mentioned also that there is no symptoms. But what are some of the telltale signs that doctors, someone who present themselves or doctors would recognize to, push someone to be tested for prostate cancer?
Right. So as we talked about previously, the symptoms or the signs only occur in the advanced stage.
There's no external symptoms.
Right. So in the early stages, there is no symptom. And that brings us to the very important aspect of screening. Mm-hmm. Right. Screening is when you test for a disease in a patient who has no symptom. And that is, what we need to advocate for prostate cancer. The same way we advocate for mammograms. So every woman after a certain age, 40 or 45, they do a mammogram every 2 years and so on. So same thing for prostate cancer. There is a screening where we actually do tests. So one is a blood test, a PSA blood test, which prostate-specific antigen, and then the other one is a digital rectal examination, right? And so we actually recommend this from the age of 40 for men who are at the highest risk, right? So in other countries, they usually start screening from the age of 45 or 50. We're recognizing that Caribbean men, particularly those of African ancestry, have some of the highest risk, right? In the Caribbean, the guidelines recommend that we start screening from the age of 40, right? So this is a blood test that you should be doing once per year, and a rectal examination for those who, you know, are so inclined. There's some men who don't like that part of the assessment, so that's fine. We can leave that out for those men who feel strongly about it. But a blood test gives you a lot of information. So it's a simple blood draw, and if that blood test comes back higher than what we expect based on your age, your ethnicity, your size of your prostate, then therefore the testing that we need to do to confirm whether you have cancer or not.
So let's say you have prostate cancer. Can this lead to other cancers?
So generally, no, right? The fact that you have one cancer, it does tell us.
Is it restricted just to one area, or can it spread?
Right, so prostate cancer, eventually, like all cancers, it will take over the organ and then it will start to spread. It will metastasize and go to different parts of the body, including the most common one for prostate cancer is a bone in the back. And that's why a lot of men with advanced cancer, prostate cancer, they have a lot of back pain. And in, you know, unfortunate cases, they end up with compression of the spinal cord. Right.
So compression of the spinal cord, that's interesting, because you always hear people talking about back pains and so forth. What happens, and what are some of the telltale signs as it relates to compression of the spinal cord? What happened there? What you will experience with a spinal cord going bad, as we would say?
Right. If you have very advanced cancer that has spread to the spine, then the spine will collapse. The bones in the back will collapse. Now your spinal cord goes through that, as where all the nerves that control the lower part of your body will pass. So if you knock all of those out, you end up with weakness in the lower limbs. You cannot stand, you cannot walk, you have no feeling, you have no control over your bowel movements, you have no control over your urination. Right? Now that's a terrible situation to be in. And that is the reason why we're advocating for screening to catch the cancer in the early stages. Right? So if we were to detect the cancers early, we want to actually prevent patients presenting with those advanced symptoms. Right? In the developed world, where we actually do a lot of screening, we do a lot of these blood tests routinely, only about 5% of patients will actually show up at diagnosis with stage 4 cancer, which is cancer that has spread. Unfortunately, in our population, we're seeing as much as 40% of our patients in Guyana, and in the Caribbean, we're seeing up to about 25% of patients at the time of being diagnosed with cancer, they already have stage 4. The international standard is just about 5. And we know that screening, you know, and early detection can actually prevent that. Right? So the screening is actually the most important part, I believe, in dealing with prostate cancer and in tackling this issue of prostate cancer. We've seen, and this is well established in large trials, including, you know, close to 200,000 men in Europe, and we've seen this in the US as well, where they actually do prostate cancer screening. The men are detected early, there's a higher cure rate, the outcomes are better, there's less risk of dying from prostate cancer. It's cheaper to treat cancer in the early stages than in the advanced stages, and we know that it reduces your risk of dying from prostate cancer. So definitely screening works. We know that. We've seen that done elsewhere. And it's about time that we start to do that on a national level here as well.
We see communicable and non-communicable diseases. There's always the, you know, ratcheting up of prevention messages, and how do we prevent certain diseases. And, you know, most of our diseases are lifestyle, and of course we'll talk about changes in lifestyle. Someone at age 40, not wanting to do a screening, but now is interested in, let's say, what should I do? You know, what should I do to prevent myself from, you know, getting or developing prostate cancer?
Right. So there might not be very much that you can do to prevent it. What you can do is make sure that if you were to develop it, that you catch it early at the point where you can actually cure the disease.
Right. So, right. So let's walk it through now. Someone is screened and tested positive.
Yes.
Let's say the person's age 40. It's now in its very early stage.
Yes.
You're the doctor. What do you tell that person?
Right. So when we make a diagnosis of prostate cancer, the next step is to determine what we call stage of the disease. Stage talks about where is the cancer in the body, the extent of spread. And two things that we're really interested in finding out. Is it in the prostate or has it gone outside? That's basically what we need to find out. And we will do either a CT scan or an MRI or a bone scan. There's certain imaging studies that we will try to establish to where the cancer is. If it's in the prostate, if it's early stage, stage 1 or stage 2, we can actually offer curative treatment. And those treatment options are one of two things. We can either offer radiation, which is like very strong X-rays that we use to burn the prostate, or we can offer surgery where we remove the entire prostate gland completely, cancer and all. And those are curative options, right? And very high cure rate, upward of 90% cure rate once you catch this thing early. Right? If unfortunately at the time of diagnosis the cancer has spread, it has, you're already at stage 3 or stage 4, then there is really no chance of cure at that point, but there is still very, very good treatment that is available that is going to prolong your life and prevent some of those debilitating complications that we talked about, including spinal cord compression and paralysis of the lower limbs and so on. Even if you have stage 4 cancer and you get proper treatment, we can still avoid that. We can still prolong your life. We can still give you a few extra years of life with proper treatment of stage 4 cancer. So it's still important to make a diagnosis early.
In the early stages, stage 1 and stage 2, once you got it, I know let's say you opt for medication. How long, in your experience that you have noticed, how long the treatment would last for, on average?
So there's no medication really that can be offered to the early stages. You shouldn't not be offering medication, right? The intention at that point and the whole point of detecting the disease early is to eradicate it completely. So either surgery or radiation.
Right.
Right? And once you do that, the intention is cure. You don't get prostate cancer again for the rest of your life.
Right. And so the other stages, stage 3 and 4, you go on medication, and as you did say, you could live a normal life, but there's no hope on being cancer-free in stage 3 and 4.
Generally, no. There is not, Stage 3 a little bit, because stage 3 is when it's locally advanced, meaning it has spread just around the prostate into other organs, such as the blood and so on. Yes, some of those patients can still be cured, but stage 4 is where it has gone to different organs, gone to the bone or the lungs or the liver. Then generally you're not going to see a cure in those patients.
Right. Another question someone want to ask. So stage 1 and it's completely gone through an operation or radiation. What's the possibility of it coming back?
So there is always a chance that with every cancer that it can come back. So cancer patients generally are never discharged from our clinic. They always get a follow-up either every 3 months or 6 months or 1 year, where we do that same PSA blood test that we talk about. That gives you an idea as to if there is any recurrence of cancer. Right? So yes, they do come back, but they just above between 5 and 10%. Right? There is a 90 to 95% rate of cure. So meaning you never get it again.
Stage, now in the latter stage, 3 and 4, what other complications can develop also when you have stage 3 and stage 4 cancer?
So you
talk about the spine and so forth.
Right.
Outside of that now, what else?
So it can cause similar symptoms as an enlarged prostate. Because of the extent of it is starting to squeeze on the urinary channel, you will have some of the same symptoms of not being able to pass urine properly, coming out in trips, straining a little bit. Blood in the urine is a big one, right? A lot of pain. Advanced cancer is a painful disease, right? So a lot of pain in the pelvis, a lot of pain because when it starts to irritate the nerves, you get a lot of pain in the legs, weakness of the legs. If it's spread to the liver, it can affect the function of the liver. Spread to the brain, you can have patients presenting with seizures and headaches, difficulty with vision, depending on where the cancer has spread to. You will have symptoms related to something growing in those areas.
So at what age, and based upon your information, with the age, that's part of a man's life, and you said some at age 40, how soon someone should avail themselves to be tested for prostate?
So at the age of 40. For Guyanese men, we're recommending the age of 40 that you should have this testing done, which is the blood test at least. And if you're so inclined, the examination every year starting from the age of 40, because we know that we're seeing some of the most aggressive disease and some of the highest risk of dying from the disease. Right? And this continues until the age of 69. Right? We also have to look at life expectancy, and our life expectancy is somewhere in the 70s. So generally we stop at around 69.
So, but after that, age 69, 70, and a person living normal life, there's no possibility of them contracting, or sorry, being infected by prostate cancer.
So yes, your risk of developing prostate cancer increases with age, right? But your chances of benefiting from routine screening, meaning, I'm not saying that if you have problems passing urine and you're in your 70s or 80s, we're not going to test you. Yes, we will test you. But for a man who's totally asymptomatic, we generally don't recommend routine. We're not going to say every 70 or 80-year-old man should come and have a PSA, as we will say for a 40 or 50-year-old man. But it all depends on his expected, his life expectancy and his general health condition. If he's otherwise healthy and his parents live to 100, then yes, by all means, he should be checked, but not routinely for every man in his 70s or 80s.
All right. We're talking prostate cancer. We'll take a break. When we come back, we'll have more for you in our final segment.
My name is Leon Seaton, national swimmer of Guyana, and I received my COVID-19 booster shot. The COVID-19 booster shot has proven to be something very effective, and since I'm a swimmer, it was something that we needed within the world of swimming to participate in games and traveling. So to me, it was very efficient in taking the vaccine. My words of encouragement to you is come out, take the vaccine so that you can go places, do things, and live a better life. Stay safe. Get your vaccines today.
Welcome back to our final segment. We're talking prostate cancer, of course, and it's all related to men's health. Sometimes we don't want to talk about certain issues as it relates to men. A thought came to mind when we were in the break. Do I need to worry much? Let's say if I found out my father would have developed prostate cancer, is it hereditary? Does it pass on?
So yes, we do know that persons who have a close family member who has prostate cancer, they have a higher risk of developing prostate cancer than the average population. So about 4 to 6 times higher risk, especially if you have a first-degree relative, so father or brother. And even if you have a cousin or an uncle who's developed prostate cancer, you're still at a higher risk. So the answer is yes. And in those special situations as well, we also recommend screening even at an earlier age. 10 years before your relative was diagnosed with cancer, we will actually ask you to start screening. So if you had a brother who was diagnosed at 45, we would say your screening should not wait until 40, it should actually start at 35.
In Guyana, we're seeing, men, someone who knows someone who developed prostate cancer. Our healthcare system here in this country, is it adequately, equipped to handle prostate cancer?
So it is very important that if we're screening men and we're making a diagnosis, then we should be able to offer them treatment. So the short answer to that is yes. We do offer treatment for all stages of prostate cancer. Of course, there is always room for improvement. There are always new technologies, and just, medicine is an ever-evolving field, and there will always be newer techniques and newer technologies and medications that we may not have at this very moment. But yes, we do offer surgery. So for the early stages of cancer, surgery is available, and it's available, free in the public sector. It's also available in other sectors. We also have radiation available. Right? There are different forms and techniques in radiation, so we may not have all of them available, but yes, we do have radiation available as well, and that will be those are the curative, treatment options. So even for the advanced cancers, we do have good treatment options available. In those cases, most of the treatment is hormonal manipulation, so there are medications, tablets, and injections that we can offer to control the cancer. And then in special circumstances, we will also offer chemotherapy and even radiation, right? And those treatment options are all available locally, right? But there are always newer things that are coming along that, for those who have the option and have the insurance and so on that can support them, then, some persons opt to go overseas for their treatment, because, like I said, there are always new things that we may not have all of it here.
I must bring up this because I bring this up as often as possible as it relates to any sort of ailments, and I use the word ailments in Guyana because if you sneeze, someone say, go and use this bush. And so you know where I'm coming from. People will say, I've gone to the doctor says so, and then when you go home, they say, oh, there's a bush for that. What you would tell patients, would-be patients out there as it relates to herbal medicine, home medicine as it relates to prostate cancer?
Right, so it's a very, very common practice that we see with every disease condition, not just prostate cancer. It is dangerous. If you were diagnosed with cancer, there is treatment available. There is very good, well-established treatment that is available. If you go on to use herbal medication, you're wasting valuable time. The importance here is time, right? So if you spend a few years using herbal medication, and then by the time you come back to your physician and you had cancer which was in stage 1 or stage 2, and then it is now stage 4, you've shortened your life significantly, right? You have wasted that opportunity of a cure. So I would say to patients who are so inclined, no, it's not a good idea. There are well-established treatment options that are available, and internationally accepted treatment options.
So most important thing, get screening immediately.
Absolutely. If we can have one message that we take away from this session here, it's screening will save your life.
Dr. Rajendra Sukraj, thank you for being on our program today. We've been having another edition of Health Matters, a presentation by the Ministry of Health. Thanks to Dr. Sukraj, a urologist attached to the Georgetown Public Hospital. I'm Nazim Hussain. Thank you for being with us. Until another time, stay safe.